To bring this home, there are concerns about the exit of some major pharmaceuticals from Nigeria. There's GSK that seems to provide some cancer drugs. How much of an effect do you expect this to have in the coming days or coming months, particularly on cancer patients in the country?
Well, it depends on who you're asking because, I mean, if they're leaving, what it essentially means is that we would have to find substitutes. So in terms of the protocol and regimes for cares, there are generic drugs that you use, but there are also brands that we've become familiar with and we're comfortable with. So I don't think it's too much of a problem. Not that I'm understating the fact that pharmaceutical companies leaving is a problem, but that isn't actually the crux of the problem. I mean, when they were here, how many people could actually afford their drugs in terms of cancer care? Cancer care drugs and also drugs for chronic non-communicable diseases are really expensive. So I wouldn't really say that's really impacting my provision of care to the patients because it really is all about healthcare financing and not just the presence of these companies.
Interesting way you've put it. Cancer deaths in Africa is projected to about 1 million per year by 2030. And they say that the issue is that cancer survival rates in this part is quite low relative to other parts of the country. What do you think we're not doing well, particularly when you look at the theme for this year's observance, challenging those in power to do what is right? What is the government not getting right in this regard?
Okay, you're making me skate on thin ice here because I have to be really careful how I talk about this. But you know, it needs to be said, until you've had someone who's been affected by cancer, you wouldn't really understand the need to talk about these things. We talk about, you know, poverty and the fact that people are really having a hard time now. If you have a member of your family have cancer, you can actually shift from the middle class to the lower class, like in 2 weeks. Yeah. It's a big problem, and we don't have adequate structures put in place to help our people when they slide into these issues. You have families actually abandon their relatives because they think there's no hope. When they hear cancer, they just run for the hills. They don't want to contribute. They don't want to help out. You have health insurance companies. They don't want to cover cancer care in their packages. Why? Because they don't think it's worth doing. I mean, if the government doesn't take it seriously, why should they take it seriously? But this is a disease that has gone from about 5th most common non-communicable disease to, if I'm not wrong, 2nd right now in a space of 10 years. So it is catching up with us, whether we like it or not. And we're going to be the first hit and worst hit if we don't reprioritize and take this seriously. It is a problem.